Good afternoon, everyone. This is Dr. Bhupesh from Dr. BKM OET Institutes. And please like, share, and subscribe our channel if you have not until now. For the best OET coaching, you may contact us. And number is 76967 34256. Just doing this material from the authentic readings. And this is the first question. You have told me to do two questions. So I'm just trying to record these two questions. Again, this will tell you that OET reading is very easy. It's just about presence of mind. Maybe I will do it right or wrong. Let's see how it goes. First of all, as usual, always read the question. The manual states that wheelchair should not be used. So please, this is the only word that you have to take care, should not be. So question is simple. Where should we not use the wheelchair? Generally, in hospitals, where is the place you will not like to use the wheelchair? Inside the buildings. Obviously, inside the buildings in the hospital you will use the wheelchair. Without supervision you can use the wheelchair, you might not. Some patients are kind of independent, they do not use the wheelchair with supervision. So on uneven surface, uneven means that is what we say up and down. So up and down services, we should not use the wheelchair. Generally, it's a basic question. Again, but I'm reading it for you because in OET, we can't guess. So I will do it for you. Intended use. The active wheelchair is propelled manually and should only be used for independent or assisted transport of a disabled patient with mobility difficulties. In the absence of an assistant, it should only be operated by the patients who are physically and mentally able to do so safely. That means people can do it if they are physically and mentally active. Then in the absence of assistant, without supervision, they can use it. So that was the point. That is elimination. So you eliminate this point now. Then you go, even where restricted to indoor use, the wheelchair is only suitable for the use on level ground and accessible. Level means it should be even. The active wheelchair needs to be prescribed and fit to any other or incorrect use could lead to. So that means they wanted it to be a level surface. So uneven surface, you cannot use it. Even when restricted to indoor use, they are saying even when restricted to indoor use means otherwise they are allowed to use it in the indoors. But when they are restricted to use indoor, then it is only suitable for the level one. It doesn't mean that they are saying you cannot use it indoor. They are saying normally it can be used indoor. Even where restricted indoor, then it can be used only on the level one. So means it cannot be used on the uneven surface generally. But we could have used little bit of our general knowledge. That is what I always say. Keep your mind active. That is why we have chosen OET, and that is why for medical professionals OET is easier than IELTS. Please understand, OET is easier than IELTS because it relates to us. So where can we use the wheelchair? On the level surface, on the even surface. All right, the second question. Second question is the guidelines contain instruction for the staff who. Now please try to, again, I always say question, if you understand question, things become easy. So question is the guidelines contains instruction for the staff who. So they are talking about the staff. What kind of staff? What kind of the staff are instructed by these guidelines? What kind of staff? All right. Question is about staff. Again, reading question, carrying out the keywords, make your life damn easy. So we have to find the what kind of staff. It may be necessary to screen the staff if there is an outbreak of MRSA within a ward or department. If there is an outbreak of MRSA or any infection, if there is an outbreak, so I will read MRSA as infection. See, it will make your life 10 times easier. Again, listen to it. It may be necessary to screen the staff if there is an outbreak of an infection within a department or a ward. Result will normally be available within 3 days. Although occasionally additional tests need to be done in the laboratory, staff found to have MRSA. So what kind of staff? Staff found to have MRSA will be given advice by the department of this. Even minor skin sepsis or the skin diseases such as eczema, psoriasis, or dermatitis among the staff can result in the widespread dissemination of staphylococci. So they're talking about the staff who might infect others. They are infected, they might infect others. If a ward has an MRSA problem, staff with any of these, again, they are talking about staff. Staff with any must contact occupational promptly so that they can be screened for the MRSA. Small cuts or abrasion must always be covered. Staff with infected lesions must not have direct contact with the patient. So staff. The guidelines contain the instruction for the staff who need to screen patients for MRSA. Sorry, in whole paragraph, they are not talking about the patients of MRSA. They are saying if there is an outbreak of MRSA, the staff who has MRSA. They are not talking about the patients who have MRSA. The guidelines contain the instructions for the staff who are likely to put patient at risk. Yes, these are the staff because they might be infected. They can put the patient at risk. So that was indirectly given. And third point, again, elimination is easy. So they were not talking about patients. Elimination is easy. And staff who intend to treat patients who are infected, again, they were not talking about the patients infected with MRSA. In the whole, I will read it again for you. It may be necessary to screen the staff. They are not talking about the patient. Results will be available in 3 days. They are not talking about the patient. Staff who found MRSA, they are not talking about the patient. Even minor sepsis and all that, they are not talking about the patient. If ward has an MRSA problem, staff with any of the, again, they are talking about the staff, they are not talking about the patient. This is how you do it. So it will make your life easy if you understand just one concept. They're talking about the staff who can put the patient at risk. Simple. These are the 2 questions you said me to do. Again, listening to this recording one time does not fetch you any. You don't learn anything if you listen to it one time. Listen to it 2 times, 3 times. That is how you will remember it when your turn will come. This is Dr. Bhupesh from Dr. BKM Institutes. Thanks for your patient hearing and please subscribe our channel if you have not. Thank you very much.